following public service announcement is brought to you by Clarice, Kristen, and Tahlie.
Despite the recent decline in the number of national teen pregnancies, the rates for Hispanic teens is still extremely high. In fact, 1 out of every 2 Hispanic teens will become pregnant at least once before the age of 20. This compares to the 19% of non-Hispanic white teens.
This is of particular concern since Hispanics are the fastest growing population segment in the United States. By 2025, it is estimated that 1/4 of all American teens will be Latino. Only 21% of Latina moms graduate from high school. This compares to 42% of all teen mothers and 75% of all females. Without a high school degree, these individuals are less likely to get well-paying jobs, and nearly 80% of teen mothers eventually go on welfare.
Not only does this problem burden the individual and their family, but the entire country as well. It is estimated that teen pregnancies cost U.S. taxpayers $9 billion a year due to increased health care and foster care costs, increased incarceration rates for their children, and welfare costs.
This disparity is an ongoing cycle of misfortune that includes lack of contraceptive use and access to resources, poverty, the language and cultural barriers, as well as discrimination and racism. How can we fix this problem? We need an entire community effort if we hope to turn this epidemic around. First of all, we need to talk to our children about sex. Talking about it does not cause sex to happen, just as educating about smoking and drugs does not increase their usage. Research has shown that teens who are comfortable talking about sexual activity are more likely to use contraceptives than those who feel guilty about sex.
Requiring students to participate in extracurricular activities can also help decrease teen pregnancies. After-school activities help to keep teens out of trouble, as well as helping to develop useful communication skills for their future. Keeping young people active, engaged, and motivated to achieve greater things can help curb this massive epidemic we are currently seeing. Schools should provide activities. Expensive ones are not necessary.
Lastly, we need to improve access to preventive care. Increasing access and simplicity of obtaining condoms in the community, as well as information about safe sex practices, can help to keep teens from getting pregnant.
By preventing teen pregnancy, further progress can be made on other issues disproportionately affecting minority populations, such as poverty and education. Latino teens should be able to have the opportunity to get an education, have rewarding careers, and build stable families.